just check, see if out of the way. Well, it's about time to start. We appreciate every one of you coming. I want to say our local newspaper has run an article that the board was writing to the state about our FSA office, who were not manned by the proper number of people and county director. But anyway, I just want to ring their bell one time for helping us and printing that so everybody could see what we had done. With that, I'll call this meeting to order. Judge Bill, would you lead us in prayer, please?
Lord, we thank you for this day. We thank you for our county. Thank you for our citizens in the county. We thank you for the weather that we're having, and lead and guide us in directions to make a good decision for the county and the people. In Jesus Christ, amen.
Amen. To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Westbrook, I have no additions or deletions from the agenda.
Offer a motion that the agenda be approved.
Second. Have a motion and a second, agenda be approved. All in favor, raise your right hand. All opposed, same sign. Move along.
And the first item in the first section is recognition of employee. And I'll let Ms. Sarah Sun.
Good morning.
Good morning.
I'd invite Mr. Cody Land to come up here. The board would like to recognize and thank Mr. Land for 10 years of service to Jackson County Fire Rescue.
Ms. Westbrook, would you want your picture made with me?
Well, I don't know that it'll gain anything by but I can help. We're just glad you have to protect what we could learn and make it.
I'm great, I'm happy. One, two, three.
It always about it.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Thank you.
All right, move along.
The next item, Mr. Westbrook, is a request a resolution by the board for FDOT to allow the FDOT to work on the bridge over on Prim Road over in Gracefield. We signed the agreement at the last meeting, but DOT wasn't satisfied with that. They want a resolution to go along with it. So we're asking board to approve the resolution.
Chairman, I make a motion to approve the request.
Got a motion to approve, a second from Dr. Spires. Any discussion? All in favor, raise your right hand. All opposed, same sign. Unanimous.
Next item, Mr. Westbrook, moving into, don't have any public hearings, but we moving into section 3, which is community development. The first item is board approval of a temporary alcoholic beverage permit for Partners for Pets to sell alcohol at a private event at the Bontrager property. That should be approved by the board, so we're asking board to authorize temporary permit.
Chairman, I'll offer a motion to approve the temporary alcoholic beverage permit for Partners for Pets on the date as requested.
Second.
Got a motion and a second to approve temporary selling alcohol beverages at the Bontrager property. Everybody raise your hand, right? All opposed, same sign. Yeah. Move along.
Mr. Westbrook, this is a request for the board to set a public hearing for the next meeting, to hear the vertical bridge telecommunications, variant request at the next board meeting. Authorization to set the public hearing.
What's the board's pleasure?
Offer a motion to, set the public hearing for, February 24th, 2026 at 6:00 PM.
Second. Motion and a second. Any discussion? All in favor, raise your right hand. All opposed, same sign. Move along.
Okay, Mr. Westbrook, moving into section 4, reports and requests. First item is the consent agenda. This is a right-of-way use permit, pay the bills, and a couple of internal policies, for a couple of different departments within the county.
So moved, President.
Have a motion? Second. Have a second. Any discussion? All in favor, raise your right hand. All opposed, same sign. Motion carried unanimously. Go ahead.
Okay, Mr. Westbrook, the next item on the agenda is change order number 3 for Indian Springs Sewer Project Phase 2B. All this is doing is doing some striping on Appalachia Trail as a part of the project, getting close to closing this section out. But again, it's a change order to incorporate striping onto the road, and every bit of it is grant funded.
What a pleasure.
This is a, increase in, for striping in the amount of $21,213.97.
Yes, sir.
Offer a motion that the, change order be approved.
Got a motion and a second. That the change order be approved. All in favor, raise your right hand. All opposed, the same sign. Unanimous consent.
Mr. Westbrook, moving on to the next item. This is a request for board approval of an interlocal agreement regarding reciprocity.
Reciprocity. I learned that.
Thank you for your help, but contractor competency cards with Calhoun County. Basically, Calhoun County is just wanting Jackson County to recognize that the cards that were issued within a specific time frame should not be recognized as eligible competency cards. We have
With
that
building, with that pertain to the building. And
the building department,
inspector.
and our legal has reviewed this, and we incorporated a couple of minor changes, but it has been reviewed.
What's the board's pleasure?
For a motion to approve the, interlocal agreement and authorize you, Mr. Westbrook, as chairman to sign.
I can sign.
Second.
Got a motion and a second. All in favor, raise your right hand. All opposed, same sign.
Question.
Yes, sir, you got it.
Did they indicate why the reciprocity agreement is necessary?
Mr. Spires, back when, right after Hurricane Michael, the building official in Calhoun County, as part of that process, they have to take a test. And once you take that test, then they share that information with other counties. And apparently the building official during that window did not give the proper test. And so they're wanting other counties to recognize that the cards that were issued during that time frame when the contractors did not take the test as required by law, that those were not acceptable cards. And
Okay.
I don't know if I'm answering your question, Mr. Spires.
Question for the county attorney here. Do we have any liability associated with that agreement?
No, I specifically looked at it for that intent and purposes. You do have reciprocity with the other counties that give out the test, which is also the state test that's given out. But how the MOU is structured, it doesn't put any liability on you, and it also specifically kind of helps correct what could be potential issues by acknowledging that Calhoun incorrectly authorized some of these individuals. And so the reciprocity that you would otherwise give is being revoked for those individuals during that time period,
Okay.
so that they can't pull permits until they go through the proper testing here in the county or in another county.
But any any licensure or certification that we grant, we are responsible for that, is that right?
For the issuance of it, correct.
Okay.
And you don't have to give reciprocity, but it's how you currently have it structured, you do permit that reciprocity.
Okay. Thank you. That's all I have.
Anybody?
I don't have anything. Need a vote?
You have a first and a second, Mr. Chair. You have a first and a second on to
I made a
approve
motion,
it.
Right.
Commissioner Brown, second.
All in favor, raise your right hand. All opposed, same sign. Moving on.
Okay, Mr. Westbrook, the next item is, requesting board approval of a standby agreement for a fair event out at the Ag Center on Highway 90, to 3 hours that they're being requested to participate. And then this will happen on March the 24th, 2026.
Well, they're requesting a waiver of fees associated with that?
I'm not aware of a request that they've asked for a waiver of fees to use the facility. This is just to deal with having an ambulance there during the time of operation.
So, will we charge them for our time associated with having an ambulance there?
Yes, sir, that's what this agreement.
This is a for-profit group.
Right, and this does, we will charge them for the service of having an ambulance there.
And it's paragraph 3 specifically sets forth the charge per hour.
Okay. With that being said, I'll offer a motion to approve the request.
Have a motion. Do I have a second?
Second.
Got a second? All in favor, raise your right hand. All opposed, same sign. Move on.
Moving on to the next item, Mr. Westbrook, is a request to the board for approval of the agreement with Tivi, a medication management software that is, and authorize the chair to sign. But anyway, this is a software that Fire and Rescue would use to basically determine the dosage for certain types of medications to individuals, whether it be an infant or an adult. The state of Florida is agreed to pay for the first year of usage of this software, but has not agreed to pay for it on an ongoing basis. Chief Brunner is working on that. And if they agree to let us use it for free in the coming years, then we probably would participate. But this is just a 1-year agreement to use that software, and it would be at no cost to the Jackson County. And Chief Brunner's here if you have any detailed questions.
So this would give us,
Go ahead.
this would give us an opportunity to see how the software functions and, give us an opportunity to see if they do not agree to fund it ongoing, give us an opportunity to see if it's something that would be worthwhile to us in the future.
That's correct, yes.
Dr. Spire.
Chief Bruno, do we have any idea about the costs that would be associated in the event the state does not pick up the costs? Yes.
It was right at $4,500 an annual license, software licensing fee. So the Department of Health Bureau of EMS had a lot of federal grant funding that they're working in the 27 rural counties of Florida for EMS, that they're trying to, they're doing the 1-year trial period in hopes of being able to fund that in perpetuity for the rural counties.
Thank you.
Yes, sir.
So,
Commissioner Bryant.
Briefly tell us what it's going to do again.
So in caring for infants and children, your pediatric population, typically we utilize a length-based and weight-based way of dosing medications for children. And years ago, the length-based was done prior to, it's kind of an old and outdated thing based on the length of the child. So now we've swapped to more of a weight-based, and determining that weight for a child is very critical of getting that exact dosage. And so this medication or this app basically is takes our protocols, uploads it. This company uploads it to this app, and then determines based on the concentration of the medication we carry. You could say I'm going to a 5-pound child, it converts it to kilograms and then tells you if you want to give said medication, how many milliliters of that medication you're going to administer. So basically ensuring that you're giving the right dose to the right patient at the right time without error.
So you need to know what the child weighs.
Yes, sir. Yes, sir. So, and that's based off of either family history, most time parents know what their child weighs based on the last doctor's visit, or a best guesstimate.
Okay.
Based on the age.
Is there a track record, of other counties, other, ambulance services using this software?
Yes, this software was actually developed by the Palm Beach County Board of County Commissioners Medical Director for Fire Rescue. He actually developed this app, and he's a physician, and throughout the years has changed the model of this app. And it now includes everyone from basically birth to death, and it has an adult component as well. So,
If, you know, after the grant and
Yeah.
our year goes away, we're not obligated to keep it going if you can't get funds.
correct, we made that clear with them.
We had a choice for to either not do it or fund it ourselves.
Yes, sir. Yes, sir. There's several counties around us that are already live with this. They've had a lot of success and the employees really like it. So certainly be a trial period, but the Bureau of EMS through Department of Health is hoping to get funding ongoing as one of their ways of strengthening EMS in the rural communities. So,
Sound like a good thing.
yes, sir.
You have a motion on the floor?
Sir,
You don't have a motion, okay.
No.
Then I move that we approve the question.
move approve. Have a second. That's just, we got a motion and a second to approve. You want to say something?
No, sir. Answer my question.
All in favor, raise your right hand. All opposed, same sign. Unanimous consent.
Mr. Westbrook, moving on to the next item, number 6. This is the request for the board to approve the Community Wildlife Protection Plan, which was developed by Florida Forestry Service with input from Jackson County Fire and Rescue. The plan is presented and we're asking for board approval at this time.
What are we gonna protect?
As I understand it, this is a annual plan that's developed each year. And this is a implementation process for whenever we have a wildfire in Jackson County.
Okay, I
No, no,
wildlife, wildfire. okay.
Yeah.
no substantive changes to the plans that have been put in place previous years.
This was like I said, this was something that we were one of the few counties that did not have a robust and updated community wildfire protection plan. This primarily came out of post-Hurricane Michael. Each region for the Forest Service has mitigation specialists, and their job is to work with the local fire departments in the counties and cities, identify target hazards in their area, and they use this as part of the mitigation planning for emergency management, and it's also filed with Florida Department of Emergency Management for future disasters and stuff going down the road. And also when there's grant opportunities opened up post-disaster, especially widespread areas like the hurricanes that hit the Big Bend and stuff like that, when there's some fundings to do some of these projects in areas that they identify, maybe urban interface or protecting different neighborhoods and homes, then they'll reference this plan and go back and do that. And it's a free service that Forest Service provided to the county, as they do all 67 counties.
So by implementing this plan, it may open up grant opportunities for fire mitigation, wildfire
Yes, sir.
mitigation. projects.
Mitigation projects. And the reason they bring it to the board is the 5 of you gentlemen obviously know your districts better. And so if there's any input that we need to take back to the mitigation specialists, please let us know and we'll send that back. Yes, sir.
Mr. Chairman, I move that we approve this and authorize you to sign.
Second.
Got a motion, have a second. All in favor, raise your right hand. All opposed, same sign, unanimous consent. Thank you. I will sign it.
Mr. Westbrook, the next item is a request to the board for the approval to purchase 5 ventilators for for fire and rescue with on-site preventive maintenance plan. These ventilators are budgeted items, and if you recall, the core dollars that we received or that we agreed to receive in June, July timeframe, those dollars will be used to purchase these ventilators. So we're asking for board approval. And again, it is a budgeted item and core dollars will be used to pay for this item.
Chairman, move approval.
Got a motion to approve, got a second.
Quick question.
Any discussion, go right ahead.
Two figures in there, 84,703.20, and then the 11,800. Is the 11,800 the cost for maintenance on an annual basis? So we'll budget for this going forward.
All in favor, raise your right hand. All opposed, same sign. Unanimous consent, move right on.
Mr. Westbrook, the next item is a request for approval to increase ambulance transport rates, each year. We'll back up just a second. As the board knows, we have, entered into an agreement with a consulting firm that does our billing for us and collections for our ambulance services that we provide. The new Medicare rates have come out, and based on their review of those Medicare rates, they have recommended that we increase our rates to accommodate the ongoing increase in cost associated with providing ambulance service. So we're asking the board to approve the increase in the medical rate. And remember that because we're a rural community, rural communities are allowed to collect above and beyond what the normal rate is to accommodate the distances that we have to travel and things of that nature. So we're asking the board to approve the recommended increase by our consulting firm that does our collections for us.
This is about 2% increase.
Okay, that's what my
No, sir,
question.
and Chief Bruner might want to jump in on this, but it is an increase above and beyond that. And if you look at, I think, didn't you provide the attachment of the rates? Chief? Page 168. We're recommending the yellow column, which is a recommended 300% of what the allowable rate is.
I want to ask you a question
Yes,
before you
sir.
start. What is, if you don't mind, please, sir? What is the percentage of collection that we have?
Right now, we run about a 70 to 72% collection rate, which is above the national average. The national average runs at 60% collection rate for county EMS services. And so we actually have, along with that rate, Mr. Chairman, we have a very good, what we consider payer mix in this county. So we have a lot of our patients that have health insurance, whether it's traditional Medicare or commercial insurance or both. So we stand in a very good position as far as our collections with our patients being insured.
Are you familiar with what the percentage of people with insurance on your collection?
Yes, sir. So out of that 72%, over 65% of that population has healthcare coverage, whether it is a Medicare plan or a commercial plan. Yes, sir.
Dr. Fire?
Chief Bruner, help me out, let me know if I'm reading this correctly.
Yes, sir.
So it says for the 2026 Medicare, allowable rate for rural area for the first clause says 340.88, right?
Yes, sir. That's
And
correct.
Current charge is 483.89,
That's correct.
and the recommended rates go to $1,022.64.
Correct.
Is that 300% increase? Is that correct?
Yes, sir. So when the Medicare rates come out, the commercial providers, Blue Cross, Cigna, Aetna, those commercial providers, because we live in a rural community and we have super rural zip codes, those commercial carriers will pay 300% above the Medicare rate, the allowable rate. Medicare fee for service, they will pay their charge. The patient will usually pay around 20%. And they have federal contractual write-offs as well.
And Chief, we could go up to 350%. That's the allowable, if I understand what you said.
Correct, but we highlighted the first recommended column, which is it's a 300% above the Medicare fee for service, and that's that spot that commercial insurances in rural and super rural will pay up to for this area.
Is there any differentiation between in-county residents and out-of-county folks? Let's say you saw someone on the interstate who was out of county, how would that?
Our county, no, sir, we do not have different rates. Now, there are some counties in Florida that do charge different based on residents versus non-residents, especially tourism counties.
I guess my concern is that, let's say if it's an in-county resident
Yes, sir.
and that kind of an increase would cause them a little bit of heartburn.
Yes, sir. I could understand that.
And you wouldn't have an increase, I'm sorry, go ahead.
I'm sorry, Mr. Westbrook, correct me if I'm wrong, but, based on our consultant that has reviewed these rates, they have indicated that this is a rate that Medicare, and if somebody is on Medicare, the supplemental insurance would cover without protest.
That's correct. Yes, sir.
But the rate won't go all the way to 350% unless it's board approved, is that correct? Okay.
Whatever, yes, sir. Whatever the board approves is what they'll bill at.
Thank you.
And we're being asked to approve as per the recommendation,
Yeah.
300% increase.
So every January, Medicare comes out with their new rates, and they do a recommendation and analysis based on what our current rates are, and purely up to the Board of Commissioners. And they give two different recommendations each year, and so this is their recommended part this year. We increased them in 2024, but did not increase them in 25.
So let me see if I understand this correctly. The recommendation from our consultant to increase by this amount is based on what we think insurance will cover.
Correct.
What we know,
Insurance.
No
will cover.
insurance will cover. So we're basically saying we know that the Medicare and any supplemental policy will cover rates up to this point.
Correct.
And that's the
The ceiling.
benchmark that we're raising it to.
up to 350, but we're only suggesting
okay.
300.
Correct.
They would allow an increase up to 350%.
Correct.
We've chosen 300%. That is based on what?
So based on, they bill differently for types of communities, based on your zip code of where the patient resides or where the call is originated. So we do have a couple of rural and super rural zip code. All of them are rural. We have a couple of super rural zip codes in this county because we have a large number of zip codes that cover this county as opposed to some neighboring counties. And so being that rural and super rural, we have a higher reimbursement rate from health insurance.
I guess what I'm asking is, since the insurance would cover up to 350%, they've said 300%. Why not 290 or 310? Where did that 300% come? Is it just a number that was?
That is a number based off of the consulting group saying that this is, I guess, in a nutshell, it's the best bang for your buck with the least amount of write-off from the insurance company. It's that sweet spot that you hit, that you're going to get your maximum amount of income for your service with the least amount of write-off for the insurance provider.
And go towards covering the actual cost of our service.
Kind of, I guess, layman's terms to say it.
Commission.
Can you give us an example if John Q. citizen needs an ambulance? Where price wise, is this going to increase what he's going to have to pay?
Based on what insurance they may or may not have, yes, that's correct. They could potentially, some people have a primary and a secondary policy, and they pay little or no out of pocket. It also depends on where that patient falls as far as have they met their deductible, not met their deductible in that year. It also falls into patients that may have VA benefits or TRICARE. If a patient receives Medicaid, Florida Medicaid, or a Medicaid managed plan, by law, we cannot balance bill the patient. So we are only allowed to bill Florida Medicaid or the managed plan, and we cannot balance bill the remaining balance. Therefore, the county must write that balance off. So, and it also depends on the severity of the injury or how ill the patient is based on the level of service, how much is done.
If I could, the John Q. Public, I'm at my in-laws' house in Grand Ridge, and I need an ambulance, and I'm on Medicare. Well, they're gonna come pick me up, and they're gonna bill Medicare and whoever I have my supplemental insurance with. And based on the consultant and based on the rates set by Medicare, we're gonna be able to collect what we bill for based on the new rate. And it should be paid.
So Medicare,
It's not going, I'm not gonna have to pay a higher rate just because I'm in a rural area and because we're in a rural area, we're charging above what the normal Medicare rate is.
so them paying it is included in all this.
Yes, sir.
They have agreed to pay that
Yes, sir.
up to 350%,
That's correct.
but we're not going.
That's correct.
Anybody else? I want to commend Chief Brenner being pretty darn knowledgeable about that right there.
It's taken a lot of years and
So it's-
knowing the right people to answer my
You even
questions too.
explained it where I could understand.
Yes.
What's the board's pleasure?
And in addition, that 300% recommended, so just for a kind of information for the board, last year we returned $3.67 million in estimated revenue for ambulance transport. This would bring in additional, based on our current rates, or based on the new rates and our current payer mix and run volume, about $736,000 estimated that would come back to the board.
As a result of making this increase.
Should you gentlemen vote for that? Yes.
What's the board's pleasure?
What is the timing on this? Is there a time critical?
No, sir, there's no timeline. It's just a recommendation that they throw out every January.
And again, it's not an impact to the citizens, it's an impact to the Medicare insurance.
It could impact.
Yes, it
In
could.
some specific cases, there could be an impact.
Correct. There could be a minor impact depending on where like I said, what type of insurance, where they're at and their deductible, have they met it or not? Are they a veteran receiving
But
benefits?
it doesn't change the deductible.
It
I mean,
won't
you're
change.
paying
the
whatever that
individual.
deductible is
Right.
today, you'll still be paying that deductible a year from now, hopefully.
I think it would be safe to say in most cases, regardless of what the variables are, in most cases, it won't have any impact on most citizens using services.
Should not, for most people. There's a very small, about a 1% population that has no insurance that chooses to self-pay.
Reminding the board the budget for fire and rescue, what we collect now does not cover 100% of that, the operational costs associated with fire and rescue.
And this won't bridge that gap either.
It won't bring it up to 100%, no.
Give me a scenario where someone just had a simple health insurance type thing, Blue Cross Blue Shield or Aetna or whatever. What kind of cost would be involved with that individual?
Yes, sir. So typically, what we typically see is out of that charge, a roundabout 10 to 20% that is owed by the patient off that bill is what we see. If they just have a commercial plan that is not Medicare or Medicaid. So someone, for example, is covered just by Blue Cross Blue Shield. Typically, it's a 10 to 20% deductible co-insurance that they would pay for that ride.
So it just depends on what
type
kind of plan and
that-
what they're.
Yes, sir.
You don't have to raise your hand anymore. I see you. Go ahead. Go ahead, Jim.
Depending on what kind of plan they have, some people have a plan where they have 0 deductible, some people have a plan where they have 20%, some have 10%. So just depends on what plan the individual has.
And this is purely bring it to you guys for your consideration. So there's, like I said, there's no timeline. This is just passing this along and providing you guys with information, so.
I personally just have some problems with the percentage of increase that's being recommended by the consultants.
Yes, sir.
Go ahead, Mr. Cook.
Well, program that I see it, I had a call this weekend. And they wanted to know why ambulance came from Washington County when we had an ambulance service right in, it was in the city of Graceville. And we had ambulance in Graceville. So I said, well, I don't know. I said, you'd think the one from Graceville would go unless it's out on a call somewhere already. And then I do know we have another ambulance that comes up and stands on standby to cover both places if you have another call. And so I said, I don't know what happens there, but I said, let me find out. And I called him back. So I called Charlotte, and he told me that they've been having a real abundance of calls. And more so than all, we in a local agreement with Washington County, Holmes County, whatever. If we're tied up, it automatically sends one to closest place. I said, that makes sense. And also had two calls. And one had one come from Holmes County to Graceville. And there, so, you know, this here is probably not going to impact the citizen too much. It could help the fire and rescue, and at some point in time, we may have to put another ambulance on if it keeps being all them abundant calls. You can't cover all the calls, you know, if we're going to give the service to the people, it costs money to do it.
Yes, sir. Yes, sir. Monday, Tuesday, and Wednesday last week, like you and I discussed, we had a very high call volume during that period, during the day, in which we had to utilize both our neighbors in Washington and Holmes County to answer calls on the Graceville and 77 corridor there.
So, I mean, I don't really see where we have a whole lot of choice there, you know, and not trying to help them there, cause I mean, we may be looking down the road to put another ambulance on. If it keeps being.
Isn't it true also that we've seen, annually, an increase in call rate for a number of years, and, it was markedly increased this past year as far as the number of calls?
Yes, sir. In the end of the calendar year, December 25, we ran 11,575 calls for service we answered, which was
You compare the year before that was 8,000?
11,071. So we're each year adding about 500 calls for service each year as we keep going forward.
Yes, ma'am, in the back. Go ahead.
Question was, did you, where,
Yes,
if
ma'am.
you don't have,
Speak up, cause we won't hear you but up here.
don't, who eats the cost, y'all go up and 300%? Does the county eat that cost?
No, ma'am. If the patient is uninsured, then the patient is billed for the amount.
So they get paid, they don't have no insurance, they can't pay it, or a job?
That's why it's
Who eats the cost from asking?
Um,
Does
Oh.
that eventually go away over time or written off or what?
Ultimately, that cost will be written off by the Board of County Commissioners.
So nobody pays it. We eat it.
Yes, it's a service that we provide ultimately. And, you know, that's being a 911 service in a rural area. Some of the things you got to take the good with the bad sometimes.
But I mean, as you spoke earlier, the percentage of costs that we're actually being able to collect, percentage has gone up. And that's a result. Didn't we sometime back go to an outside service for collections?
Yes, sir. So we have a contract with a debt collector. Our process is, we accept a minimum of $25, on a patient paying per month. And so as long as they're paying that minimum, it goes to their account. After 4 invoices, with nothing happening, no response from the patient, then that is turned over to the debt collector. Yes.
Commissioner Crutchfield, go ahead.
Well, if the patient don't have any insurance, you know, most of the time it's wrote off anyway. And by that, even that's another thing. see, it costs the county or costs the ambulance services. Expense of doing that, they still offer the service. So that's even another reason, if we, have a chance to do that. I know it's kind of like attacking the insurance company, but, if that provision is there, we should take advantage of it. I'm sure other counties are doing the same.
Commissioner Spire.
I want to take exception. We're using the term that nobody pays it and we eat it. Somebody does pay it, the taxpayers pay it.
Correct. Yes.
That's exactly right.
Somebody
Yes.
pays for it, okay?
All right.
Any more discussion?
So if you get a chance to give a little extra money, that could help to not keep the taxpayer out of pay.
And also, commissioners, I highlighted the recommended in the yellow highlight. The current charge is that light blue, if it was printed in color. If gentlemen don't feel comfortable with going to the recommended highlight and we want to come back and go back over this at a different time, we certainly can fall anywhere in between if this is not comfortable for you all. We're not just married to that
And I
column.
agree with what Chief is saying, but also remember, commissioners, that the fire and rescue is running and in the red. We are not covering the cost associated with fire and rescue. But I agree. If the commissioners, if they want to leave it the same, then we can leave it the same.
There again, this 300% is basically the sweet spot percentage that we feel will be basically able to collect that from the insurance companies and won't be placing an additional burden in most cases on the citizens.
Correct.
And that came from, and Chief, you correct me if I'm wrong, that came from a consulting firm that collects for not just Jackson County, but a lot of people, and this is.
A lot of states and a lot of agencies. That's
This
correct.
is their recommendation.
That's their recommendation.
Everybody finished now.
Just looking at the bigger picture, I
That's
think at
right.
some point in time, we're gonna be looking at substantially reduced revenue from a county relative to our ad valorem at some point in time.
That's,
I mean, I think
that's
there's a
always
good-
a possibility.
I think there's a good
Yeah.
possibility of that, so, yeah.
I think we're already there.
Huh?
Sir?
I think we're already there.
I think it's gonna be
You're probably right.
pronounced if some of the legislative initiatives are passed, but I mean, that's still, I'll offer a motion to
Thank you.
I'll offer a motion to put into effect the increase as recommended by the consulting firm of ambulance fee schedule. I'll offer a motion to approve and adopt the increased ambulance fee schedule as recommended by the consulting firm and authorize you as the chairman to sign.
Thank you. I can sign. I need a second. Mr. Crutchfield, Commissioner Crutchfield, seconds. All in favor, raise your right hand. All opposed. Carries 3-2.
Hard to absorb a 300% increase, guys.
Well, and I concur with you. Same time, you gotta be able to have an ambulance that we can send to foreign different, little nooks and crannies in this county. Go ahead, Commissioner Crutchfield.
That's where the ambulance is there to offer the service to any call that comes in.
Sure.
And it, if it gets to the point where we had to depend on other counties to catch our calls, then, we're kind of going backwards. But we gotta look at it.
Again, I think that
I know what,
when we look at the entire budget, we gotta look at all areas and not just
That's well.
dump it all in one department.
Yes. Well.
and it's important there. You got somebody out there dying, and I mean, these people that called me over the weekend, they were real upset and all, cause they was thought their spouse was dying, and I know time gets critical then. A minute becomes,
Proximity is there too, though, in home.
yeah.
County.
It might happen to you, and that's,
Anyway,
you don't
Move.
never know, I mean, I don't increase on people either. But we're sitting here trying to make a decision to make it work. And that's up to us to do it.
move along.
Mr. Westbrook, the next item, number 9, is the request for board approval to put the Holy Neck Road overlay out for bid. As the commission may or may not know, over the past 12 to 15 months, there's been approximately 12 to 15 insurance claims specific to that road that we've had to fill. And also, in conjunction with that, there's a huge number of work orders that we have had to respond to, which we provided you a list of the work orders and also the insurance numbers. And so we're asking the board to allow us to go out to bid to overlay that road based on the insurance claims and the work orders associated with that road.
Commissioners,
Just
Aye.
scrap or Scott?
Commissioner Spiley,
Funded, this would be funded from the construction fund.
Commissioner Spiley,
I move to approve the request.
What is the estimated cost, do we have?
We don't know yet, Mr. Donfro. If I guess low, then that's the number that Mr. Donfro is gonna remember. And if I guess high, then all the,
Do we have any kind of,
we really don't. I had a conversation with Mr. Register and he set me straight a little bit. And we just try not to put a number out there so that it doesn't drive the bid if the board wants to do the bid.
I need a second, go ahead.
Most all they call come from out of state people.
Some of them, Mr. Crutchfield.
Mr.
But I
Chairman,
can't-
I have a motion on the floor. Second.
I need a second. Anybody got one?
not necessarily opposed to it, but before, I'd like to have at least some kind of, are we looking at $2 million? Are we looking at $100,000?
Yeah, I think he's asking for permission to go out for bid before we have any idea of what it's gonna cost.
I'd like to have an idea ahead of time. I think
How you gonna do that, Commissioner Donald?
Very easily, I put together estimates.
Are you gonna put it together?
No, sir, I said I put together estimates.
My motion, let me finish. My motion is to approve going out for bid on Holy Neck Road.
I
When
understand,
the
what you-
bids come in, we'll know what the possible cost will be.
I understand that.
So thank you,
But
Mr.
there
Mayor,
is-
recap for what you're bidding.
There is time, energy.
Okay, Mr. Chairman, I read it for you.
Go ahead,
Mr. Chairman,
Mr. Donovan.
So-
Go ahead.
I was just saying, there is time, energy, and effort on the part of a number of people to go out to bid. I'd like to know about what that cost is. I, as an architect, Mr. Spires, I give out estimates on what I think the cost will be. Of course, a lot of times those are wrong, and we won't know what the exact cost is until we do go out to bid, but, I'd certainly like to know whether this is a, $1 million project or $100,000 project.
And my motion is
Mr.
not to
Dane,
do the
Mr. Dane.
project, it's to go out with bids, Mr. Donald. You gotta start someplace.
Mr.
Mr.
Chairman,
Dean,
if I could,
go ahead.
go ahead and, share Mr. Register's comment, we're potentially looking at around 400 to 500,000.
If we're doing just to go out for bid, that's not approving the project.
No, sir, it is not approved,
I'd like
that
to
have
motion.
come back.
Thank you, sir.
So will there be any cost? Are we gonna hire an engineering firm to put those bids out?
No, sir, according to Mr. Register, that wouldn't be necessary for an overlay.
Got a motion and a second to approve. All in favor, raise your right hand. All opposed, same sign, unanimous consent, move along. But also say, what is the biggest problem there with the road? If I'm, Mr. Spires, I'm sure you drive that road most every day.
It was chip seal, I think I may be a little bit off here, but I think in the early 2000s. And it was just totally ignorant work for 4 years, and it got disintegrated to the extent that it needs to be overlaid.
Go ahead.
We gotta keep in mind too, because I know there's a lot of roads that ship seal in District 2. So that's gonna be coming down the road too, same situation.
Go ahead, Dr.
GPS is directing people who are going from Georgia to the Panama City beaches, it's directing them through that as a shortcut.
I hear that on my side of the county too.
Yeah.
Quick question. Mr. Chairman, how long is that road?
Mr. Register,
2 miles.
17,008, 11.3 miles,
Over 3 miles?
just a little bit over 3 miles.
I would say 3 or 4. All right. Ready to move along. passed that already.
Okay, the next item, Mr. Westbrook, is request, board approval of a budgeted item, RJ Young, printing and copying equipment. We're renewing that contract and we're asking for board approval. It did exceed our budgeted amount by a few $100s, which we calculate by the end of the year, we may have exceeded the budget by $1,400, in this one category. But we're recommending approval.
What's the board pleasure?
So move.
Second. Got a motion and a second to approve. All in favor, raise your right hand. All opposed, same sign, move on.
Mr. Westbrook, the next item is request board approval of the Florida Boating Improvement Grant Program grant agreement through the Fish and Wildlife Commission. This is for Howell's Landing. It's just over $65,000. And we are asking for the board to allow the chair to sign the agreement and send it back to Fish and Wildlife with approval.
Second.
Got a motion and a second to approve. All in favor, raise your right hand. All opposed, I have a statement to make about that landing. We got to have a little bit of engineering there. That landing obviously is not square, it's not flat. It's higher on one side than it is on the other one. And if you don't believe it, you can walk down there and see in your ramp itself. Yes, sir, what it is. In other words, we go in, just say we go in north and south, but it's not flat. No. And I've walked down there and my shoes are wet to kind of tell that. So it's kind of obvious that it's that way. So we would need to think about if they're gonna do it, $65,000, surely there'd be someone engineer that would look at it. Go ahead.
I have a question, not about this, but about a boat ramp, but.
Yeah.
I'll wait till we vote.
What we have, we have a boat landing there, and it's been there a long time, as many years as I can remember. But we also have one right there going into the power where it's just a dirt spot that really needs some attention there, either from our engineer or of course, the game commission has a program of that, and that's obviously what we use it now. But that one needs to be attended to too, as well as, that's in your district, I think, not mine.
And we can't forget, that is the only boat landing in Jackson County that you can get to access the Apalachicola River.
That's correct.
Mr. Westbrook, if I could,
Yes,
this grant agreement, the only thing that it is for is to purchase aluminum dock to expand the dock access at that landing, is what the board had approved. And so when we made the application, so this is just to purchase that aluminum dock. It's not for.
Yeah,
But we can't
roof
have an
over a
engineer.
house, we're not gonna put a floor in it. Yeah,
We definitely gonna get an engineer to take a look.
thank you very much. Move along.
Yeah, we did so.
We didn't, but,
You voted on item 11, but not 12. for the
okay. I need a motion and a second.
You made a motion.
Mr. Spire
He did.
the motion.
He did.
Mr. Farmer made a motion, I second.
You did?
We're on number 11, which is to sign the grant agreement.
All in favor, raise your right hand. All opposed, same sign. My apologies.
I have a quick question.
Yes, sir, you got it.
Dean, can you give us kind of an update, being that we're talking about boat ramps and docks, about Magnolia Lane?
Yes, sir, Mr. Branch, the board approved a grant agreement to award design and feasibility to DHM engineering firm. And the design is to come up with an improvement to the Magnolia Landing for access and parking and things of that nature. After the signing of the grant agreement, DHM did hold a kickoff meeting, for lack of a better way to say it, to discuss some of the specifics on how to improve access and parking at that landing. And that is being worked on to come up with some concepts to bring back to the board before we move forward with anything that might become final.
They got the work cut out for them on that.
Yes, and there's adjacent landowners, Mr. Branch, that we've been talking to that will probably become a piece of the process. But we will come back to the Board of County Commissioners whenever we have a concept.
But the process has started.
This process has started.
Okay, thank you.
All right, moving on.
Mr. Westbrook, the next item, now that we've approved the grant agreement, we want to go ahead and get the commission to agree to purchase the docking system that would be placed at Howell's Landing. The purchase price includes transportation of the system to the landing as well as setting it up. So we would not have to do anything. It would be done by the firm that we're asking that the board approve the agreement with.
So move, Mr. Chairman. Got a motion?
Second.
Second. All in favor, raise the right hand. All opposed, same sign. Move along.
Mr. Westbrook, this is requesting board approval of change order number 2 for the Jackson Hospital air purification project. Remember, this was a project that started after Hurricane Michael. It is improvements to Jackson County Hospital. The funding was applied for through the Board of County Commissioners because the hospital was not eligible to apply for the grant. It's a CDBG grant, and it is funded with 100% grant funds. This would use the balance of the funds that are associated with that grant, and also add 150 days and make it clear that all work, including the inspection and testing and everything else, would be covered 100% by the grant, and that if it exceeds that amount, the hospital would be responsible for anything above and beyond that.
For a motion. Second.
Got a motion and a second to approve. All in favor, raise the right hand. All opposed, same sign. Go ahead.
Mr. Westbrook, the next item, number 14, is request for board approval of master service agreement, EHP. If the commission remembers, we had our special meeting in January where we had a presentation by Mr. Hummel, and he presented the program that is 100% voluntary by our employees. There's no requirements whatsoever. And so we have negotiated an agreement. It's been reviewed by neighbors Gibling and Nickerson, and they have incorporated some changes into that agreement. And we're asking for board approval of the agreement.
What's the board
I
pleasure?
make a motion to approve.
Got a motion to approve and a second from Commissioner Bryant. All in favor, raise your hand. All opposed, the same sign. Move along. You got anything else to tell us?
Westbrook, the last item, I believe we have someone here from the Mariana High School band, and they wanted to make a request, and they wanted to do it personally rather than me just read the agenda item.
That's fine.
Good
Thank you
morning.
for coming. Yes, ma'am. Good
My
morning.
name is Jennifer Bernier. I'm the current Mariana High School Band Booster President, and with me today I have Mr. Zach Horn, who is our current band director. And we're here to talk to you today about our amazing opportunity, which is to march in the Sugar Bowl Parade next year in New Orleans, Louisiana. So with that, I'd like to turn it over to Mr. Horn.
Yeah, so,
Thank you.
yes, sir. We got this honor, we received this honor this year at our MPA competition. We received superior scores this year for the first time, overall superior scores for the first time in 13 years. I was really proud of our group for doing that. And basically someone on the Sugar Bowl parade board was there, we didn't know, and they contacted me about 2 weeks after that and wanted us to represent the Panhandle of Florida for to participate in this parade. The parade will be January 17th, 2027. It's actually now part of the college playoff tournament. So it's a pretty big deal for our area and for our students, and we're extremely proud of the work that they put in and everything that they've accomplished this year. Do you want to talk about
What's the
that?
board pleasure?
They're asking for a waiver of the fees.
Yes.
Yes, sir. We're having a fundraiser on May the 2nd. It's a Gatsby After Dark event. We're going to have a jazz and dinner show. We have an amazing jazz band, and we are so excited to be doing this fundraiser. The funds we need We need approximately $82,000 to travel to New Orleans. That's roughly $1,000 per student. We currently have 81 students in the band. And even with the seniors that are leaving this year, we're planning on having the 8th grade class come up with the same amount of number. So we're still going to need that full amount to fundraise for. So we're asking the board if you would be willing to waive the fees for us to have the peanut room at the Ag Extension office in order to have this fundraising event.
Go ahead, Mr. Brant.
I was going, make a motion that we waive the rental fees for this event.
Second the motion, and
Not as you saying.
I'll say that it's quite an accomplishment to be invited, to participate in the Sugar Bowl parade. It's quite an honor, and, I think both to be congratulated and all the members of the band would be congratulated for the performance that got them there. So that's quite exciting.
Thank you.
Good luck with the fundraising.
Thank you.
Got a motion and a second. All in favor, raise your right hand. All opposed, same sign. Request granted.
Thank you.
Yes, ma'am. Thank y'all for
Good
coming.
luck with it.
That's correct.
That was the last
Yeah.
agenda item, Mr. Westbrook. That was the last agenda item, Mr. Westbrook.
Board members got anything they want to add or bring up?
I do.
Okay. Will you recognize?
We've had an ongoing issue on, I think the board's aware, on Thompson Road, where we added some guardrail. One of the things I'd like to consider, is actually adding, to make people aware of those curves, because we have had people that have run off those curves and into, one of the residents, that live right along Thompson Road. I'd like to request that we put up I don't know, it's a solar, operated, caution, sign that basically warns, travelers along that road that there's a curve.
Let me chime in just a little bit. That's a death trap right there. And it's been that way ever since they put it up. Now, if they moved it back or we took it down and still had what you're mentioning, that's not a good remedy for what we got there. We still got the death trap. I agree with you 100% about the flashing sign. I got no problem with that. But if we don't fix that by either taking it down or moving it some way back away from that road, that is a death trap. And agriculture is moving that the heavy disc and equipment up and down that road. And that curve is too great. I've talked to local attorneys. I've talked to various people. And I certainly don't want to take over in your district, guys, for sure. But we got to do something drastic about that guardrail. I know the gentleman that lives in the house. I know him personally, been knowing him all his life too. And there's a huge yard there in front of him. But somebody's got to put some special attention to that, or we're gonna be embarrassed.
We actually had, DRMP, and I know Donald Stanley is here. He doesn't go work for DRMP any longer, but I know that DRMP did a study. Mr. Dean, I don't recall the specifics of that, but, I do know that we looked at moving that guardrail back and maybe even reducing the overall length of it. And I think that we had gotten a cost estimate.
We did.
for doing that.
And it was as much, may I interrupt, just stay right there? Yes, sir, we did do that, and you're right. But the cost to fix it or change it was as much as it was to put it in to begin with. So that was just a drastic amount of money, in my opinion. Now, I know this board's got to decide that, and I accept that. But at the same time, that is going to put us in an embarrassing situation. But I yield to you in your district, and I respect that part of it.
Well, this was initiated by the persons, and I won't say who it is, that lived there in that house, that have had a number of incidents of, people coming off that curve and ended up in their backyard. They were concerned about the life safety of their children playing in the backyard.
You're talking about prior to putting the guardrail up.
I'm saying prior to putting the guardrail up, they had 3 or 4 incidents. Matter of fact, while they were, correct me if I'm wrong, Mr. Register, but while they were putting the guardrail up or in the process of starting that, they had another person fly off that roadway and end up in their backyard while the construction was going on, or right before it was getting ready to be initiated.
And just prior to it is a graded road that goes to the south and then to the west,
Right.
right there. And they live there, unless they change houses, there's a mobile home there. I've walked back and forth around that thing about a dozen times.
They live right at the corner of Bart Road and
That's exactly
Thompson
right.
Road. And it is a dangerous situation, and there had been a number of vehicles that had come off that road and ended up in their backyard. And they were rightfully so concerned about, their life safety.
In my opinion, and I'm certainly not a road man, I'm a water well contractor, but I got enough business sense to look there and see. We either gotta move it back, or we gotta shorten it, or something to get us where we won't be the liability. And Mr. Herman Larimore, attorney here for many, many years, he and I have discussed it a half a dozen times. And I don't think he'd mind me mentioning his name, but it is a danger that we got to deal with, and we have another one in my district down there on the Reddick Road, and it's just as bad with nowhere to go. Go ahead, Mr. Brown.
Has anybody, thought about seeing they could do a redesign on that road right there?
Actually, to increase the super elevation,
I don't know.
change the curve.
Yeah, change that curve some.
I don't know that that was in, and again, I'm not gonna call on Mr. Stanley, but I don't know that that was actually part of the study. Donna, you wanna,
Come up, Don, if you don't mind. That's Donald Stanley. He's a fine fellow, and I've been knowing him since he was a little boy. Go ahead.
No, sir, that scenario was not looked into to the best of my recollection. I do think that presented some options. Mr. Dean, do you have a report on that?
Yes, there was a report done, and like Mr. Westbrook said, I think the only one I could remember was removing it. It was like $170,000.
That's right.
There was a second option, but I can't recall. I'm not going to speculate on what that was, but all of us have looked at it many times, and we talked about shortening it up. We've talked about moving it back, and you have to deal with the ditch if you move it back.
There's a fall off there, yeah.
I mean, I'd be glad to meet with Mr. Donifro and Mr. Register and Rhett and just try to come up with a solution. But I think that in talking with the landowner myself, shortening it up, which would be shorten it up from the west was an option that he had no problem with. But that might give some relief where if a heavy piece of equipment was coming and it was sticking over on the side of the road, there would be more room so that they could see around that curve.
One of the problems is 14 inches off the road. It's where the guardrail is. It's off the edge of the highway of the street, or that's what you don't call it. That's one of the biggest problems there is right there.
Charlie, do you know, have we had anyone hit that guardrail that you're aware of? Commissioner, that's correct.
How many near misses have you had? You don't know either. I agree. Go ahead.
That's not to say it hasn't happened, but.
Yeah. Well, I do know that also, in looking at this, Rhett and I and Jeffrey met down there, actually got permission from one of the adjacent landowners to clear some of the, a tree line to improve the sight lines along that road. And I don't know if that helped out in conjunction with maybe shortening the guardrail. That may improve the situation. But there again, I'd be happy to meet with Rhett, Jeffrey, Jim, and come back with a recommendation.
Mr. Donfro,
Yes.
I didn't personally prepare that report, but I would like to point out in the event that y'all did relocate or shift the rail back, that would have impacts possibly outside the right of way. To move the rail back, you would have to build that shoulder out and the tie-in point move out at that point. So you could potentially be looking at right-of-way acquisitions in that scenario, or like you mentioned, if you did pursue taking that curve out, that would be a acquisition.
Above and beyond everything else, when it's all said and done, it's a dangerous place and we're gonna get somebody killed right there. I yield my time back.
We'll look at it again.
Okay.
Go ahead, sir, in the back. 3 minutes.
Yes, sir.
Thank you.
Good morning. Aaron Hilton, I lived out there in that community all my life. And right there on Tanner Road, not Tanner Road, but
Bart Road.
yes, that is a dangerous curve. So many people done got killed on that road. Nobody never mentioned that. Right there where y'all talking about, been a lot of deaths. And for the people moved in that trailer, it's been a lot of accidents there. But ain't but one car ever went in that yard that I know. And I've been there all my life.
We appreciate your
And when they were
input, sir.
putting it up, I told them guys, I said, that's a death trap there. Y'all putting this too close to the road. But they said, no, it's DOT approved. I said, what? They said, yep. So I left it alone.
Yeah, we,
Thank y'all.
thank you.
Thank you.
Thank
Go ahead.
Part of the
Cut, yeah.
problem, a lot of the main probably danger is, with all the farm equipment is a lot larger than it used to
Exactly,
be.
correct.
You can't stay in their own lane. They take up the whole road at the best. And that curve, if another car coming around it and they coming fairly
Can't
fast
see
or
it.
whatever, or they gonna meet and there's nowhere to go.
Yeah.
Can't run in the ditch or anything.
Yeah, I'll climb that guardrail.
I could, Mr. Donifro, you had called me the other day about, River Forest Road as well.
As well.
Do you want us?
Yeah, I would like to also, there's a curve there on River Forest Road. This is the road that runs around the north side of the college, and we've had a number of complaints. Had a request to reduce the speed limit from 35 to 25, which I'm not opposed to. I just don't think without additional enforcement, that really has as much of an impact on slowing people down as maybe a couple of, again, solar operated caution signs that basically warns people that there's a hard curve coming up, and they'll pay more attention to those flashing signs, similar to what the city put up right at the four-way stop. I mean, you don't miss those. And so that would be the second request, is to place a solar operated warning curve ahead sign up.
And would that be discretionary funds from?
That could be out of my discretionary funds. But still have to have approval to do that.
Is that a motion? One second.
Okay, one motion and a second. All in favor, raise your right hand. All opposed, same sign.
Yep.
Anybody else? Anything else? Yes, sir. Mr. Reggie.
Question over from Don Pro. So you want the signs on 8 AM on Thompson and
On River Forest.
That didn't include Thompson now. Did you mean it didn't include Thompson?
Yeah, I did mean to include both Thompson and River Forest, and that would again come out of my discretionary funds.
so a total of 4 signs.
4 signs, yes, sir. And then I'll get with you. We'll go down there and locate where the most appropriate location is for both of those.
Okay.
May I be kept in the loop if there's a chance that the chairman can be kept in the loop?
Yes,
May I know what's going on?
I will reach out to you whenever.
Thank you
Go
very
out there
much.
with
You do a good
post-it.
job anyway. Anything else?
Mr. Westbrook, before you slam that gavel,
You caught me.
a couple of things. We have received a report from an arborist, out of Washington County about the, is it an elm tree? Maple? Oak, the one right in front of the courthouse.
That's a live oak.
Diseased and, needs to be taken down. It's right next to the highway. In conjunction with taking that down, it was suggested by the court system that we look at doing some type of sculpture, with the stump that they take out. Of course, the, courthouse funds would pay for this, not the Board of County Commissioners. And to take the tree down and to do the sculpture would be approximately $10,000 to $15,000. but we would need board approval to use the courthouse dollars that come from the court system.
Okay. Do we have an idea of what the sculpture is going to consist
Now,
of?
I'm glad you asked that question, Mr. Donifro.
Well,
There's been two suggestions. One would be the, Lady Justice holding the scales, or it could be the Jackson County logo. Those are the two that have been thrown out there.
may I include something here, if I might? That we ask the NAACP to participate in that decision making there.
Okay. Are we okay with the expenditure of the funds to take the tree down?
I think so. If our road and bridge can't take it down, it's a smaller tree, but if they can't take it down, yes, I would.
It's right there on Highway 90.
Right where it is. I can't see around that curve out that window I'm looking at, but.
Very good.
it's
I
around
just,
the very
I
part
mean,
to the
our
right.
road and bridge department, I put them up against anybody in the state of Florida, but cutting down a tree right there on Highway 90, I don't know that we would want to take on that liability.
Well, that tree would more come down over here on this street than it would on Highway 90, and then you got a 4-lane there, you got a turn lane there, so you got a lot more room there than normal. I've been driving by that thing for a long time, but anyway, bear that in mind.
Yes, sir.
I do know that when the last time the courthouse was renovated, we had an arborist come look at all the oak trees on that one. At that point in time, this was 10 years ago, was pointed out that it was on its last leg 10 years ago. So it's something that,
Well, you can see it's already turned now for the most part. The leaves and the limbs on it already turned brown, so a live oak.
I'll offer a motion to approve the use of courthouse funds in an amount not to exceed $15,000 for cutting that tree down and creating a sculpture utilizing the scales of justice. I think that's an appropriate for a courthouse, an appropriate icon, if you will. But before we give final approval, I'd like to see from the artist some type of rendition of what they're talking about.
And we can do the tree, take down the tree first, and then get with the NAACP and, give them this information, but get the tree down before something.
And they may not want that. I haven't asked.
Yeah.
I'm just saying what.
But we would bring that back to the board at the next meeting.
The sculpture would be
What-
part of that process as far as knowing how far to take it down.
Yes.
Everybody got anything else?
So got a motion on the floor. Need a second or a done?
Second. Got a motion and a second to not exceed $15,000 to take the tree down in the courthouse. All in favor? Raise your right hand. All opposed, same sign.
Cyrus, can I talk to you before you leave?
Were we finished? You want to say something else?
No, sir. I was getting ready to.
Anybody? Oh. That's good.